But when most people think about health, they think about health care. Ministers of health think about health care. 20% of the health of the population is health care, and the other 80% is social determinants of health. Why treat people and send them back to the conditions that made them sick? In the United States, if your parents are poor, you will be poor. The land of opportunity is a land of opportunity if your parents are rich. If your parents are poor, it is not a land of opportunity. That life expectancy in the US declined 3 years in a row. And the big increase, unintentional injuries. Unintentional injuries include accidental drug overdoses, but deaths from opioid poisoning are not randomly distributed. The lower the years of education, the more deprived the population, the higher the mortality from poisonings, suicide, and alcohol. And you can see the social gradient. So the gradient has got much steeper. The inequalities have got much bigger. Now, if you think that health is a matter of personal choice, if you are one of those politicians who say people only have themselves to blame, well, what a terrible choice to choose to be born in Hungary, when you could have chosen to have a Norwegian mother and be born in Norway. You've only got yourself to blame for choosing to be born in Hungary. And if you're so stupid as to choose to be born in Hungary or Romania, make sure that you get a university education. And the way to do that is to have a parent with a university education. So it's up to you. Choose Norway, not Romania. Choose a university-educated parent, not a working-class parent. Let me come back to the theme of poor people only have themselves to blame. We recommend healthy eating. If people in the bottom 10% of household income in England followed the healthy eating advice, they would spend 74% of household income on food. If they eat healthy food, how can they pay the rent? If they pay the rent, how can they eat? If they eat, how can they heat? I chaired the WHO Commission on Social Determinants of Health, and we called our report Closing the Gap in a Generation. And we said on the cover of our report, social injustice is killing on a grand scale. Invest in preventing mental illness in children, and you'll reduce crime rates as well as improving health. Cold housing is damaging children's mental health. Cold homes and heat, both a problem. The impact of the heat wave in Europe in 2003, the estimate was 14,000 excess deaths in France. So climate change is going to make the problems of deprivation and health worse. When I opened the French Healthy Cities document, the first thing I saw was proportionate universalism. The only way to deal with the gradient is to have universalist policies with effort proportionate to needs. Getting richer is not the solution to getting healthier for a country. Investing in the social determinants of health is the way forward.